Hello to everyone. In this video we'll be discussing on the short topic that is our gallbladder cancer. We will be discussing a brief overview on this topic. So this is a cancer of gallbladder. Now the carcinoma of gallbladder is a malignant tumor. As we all know, malignant means the metastasis, and that develop as a result of uncontrolled division. That is a division of cells of the gallbladder uncontrollably, that is not under the control, and this leads to the growth of epithelial cells of this organ. Now it comes under the group called as the biliary tract cancer, this gallbladder, as it is connected with the biliary or the bile pathway. Okay, it goes into the duodenum. Now among the patients with a biliary cancer, 2/3 of the tumors are of gallbladder cancer and 1/3 tumors are of cholangiocarcinomas. Okay, so the cholangio means the bile ducts and all, and related to that, cancers are 1/3 out of all biliary cancer, and 2/3 are the cancers of gallbladder. Okay, now what are the risk factors who are mostly affected? Now it affects basically the elderly and age above 50. So the patients who are above the age of 50 are more prone to develop gallbladder cancer, and it is less common in the people who are below 50 or younger in age, and it is more common in men than women. And at risk we consider over 70 years, it is at high risk. The people are at high risk of developing gallbladder cancer. Now inflammation of gallbladder or gallstones or any type of gallbladder disease further a person is having, they are also more prone to develop gallbladder cancer. Now gallbladder polyps, if previous diagnosis is there, then they have the chance. Adenomatosis of gallbladder, obesity, smoking, and genetic predisposition, that is a genetic factor. Now stages of gallbladder. Now we have stage 0, that is called as, in which the cells are not altered, the normal place of the gallbladder. Now stage 1 affects the muscular layer only of the gallbladder. Stage 2 goes to other organs, but lymph nodes are not affected. So it can go to liver or somewhat duodenum, the nearby organs, metastasis, but it will not go to the lymph nodes. Now stage 3 spreads to liver, stones, pancreas and intestine, and may also go to lymph nodes. But in stage 4, the tumor penetrates into the portal vein and distant metastasis appear, example in lungs. So the distant metastasis now develops in the case of stage 4 cancer. Now let's see some images here. So you can see this image. This is the gallbladder cancer image. You can see it here. Okay, so this is a gallbladder, and this is your liver, duodenum, and this is your liver, under which the beneath the liver the gallbladder is present, as you know, and this is your gallbladder cancer, you can see here. Okay, now you can see this ultrasound image of the gallbladder. You can see this black part, all these linings are showing the cancer of your gallbladder. Okay, so this is gallbladder. Now let's move on to further details. Now what you will see here. Now what the instrumental diagnosis, as I shown you the ultrasound. So firstly, ultrasound is done to confirm the diagnosis, and we should differentiate it from polyps, gallstones and cholecystitis. So these disease should be excluded before confirming the diagnosis of gallbladder cancer. If the tumor is detected, then we will go for the CT scan or the MRI is performed. And further we can also do antegrade and retrograde cholangiopancreatography. Okay, so this is, will be seeing the blood vessels and the bile duct in this type of instrumental diagnosis. And if the surgery is to be done, then we will do the PET CT should be done. Okay, so PET CT, you can see this image here for the PET CT. So you can see this is actually the CT image cross section, and here you can see the PET CT. You can see it here. This is the increase the FDG uptake in the primary lesion inflating in the liver. Okay, so this is the brightened part where you can see the lesion that is in the gallbladder. Okay, so this is the PET scan. And this you can see the stages of the gallbladder cancer. So T1 is the first stage, in which only in the gallbladder is confined, and further proliferation or progression is again inside the gallbladder, but it is increased. Okay, and third, it has hepatic invasion, or you can say it goes inside the liver, so the metastasis to the nearby organs. And if in the fourth stage it goes to two or more nearby organs, like you can see this is your duodenum and liver or somewhat portal vein, you can see it here as I told you. And the fourth stage, it actually does to goes to the portal vein, or somewhat also goes to the lungs. That is called a distant metastasis. Okay, so this was the stages. Now as I told you, the PET CT scan, we can also do laparoscopy, endoscopy to detect the small size of cancer. And lab test, what we do is general blood test we perform to check the cells, and we can also do the tumor markers test to confirm the further diagnosis. Now we have surgical treatment here. In the surgical treatment, we have the resectable and unresectable. So in resectable, if the gallbladder is removed, in resectable, if the gallbladder is removed, then tumor will fully removed. Okay, and in unresectable, it cannot be removed surgically due to spread to different organs and nerves. Okay, now cholecystectomy is the further surgical treatment we do if it is only confined to gallbladder, and palliative treatment is to relieve pain and prevent complications. Clear? Now we have radiation therapy, in which we use X-rays, gamma rays to destruct the cancer cells, and may be also used after the operation to kill the remaining cancer cells. So after the surgery, if some cancer cells remain, then we use this radiation therapy. Okay, and can be used where the surgery is not possible to prolong life. So if the case surgery is not possible, then we use radiation therapy to prolong the life of the patient. Now chemotherapy is also an option. We can go with chemotherapy. Cancer killing drugs are injected in the vein, meaning of chemotherapy, and it can be also taken orally, and after surgery to remove a tumor or to reduce the risk of returning cancer. Okay, so it is done or after surgery to remove somewhat tumor is left, or it is also used to reduce the risk of recurrent cancer. And it can also be used as palliative therapy, and they can reduce tumor growth, tumor size. Okay, and the cycle of chemotherapy is around 3 to 4 weeks, and then again the rest is given to the patient, and the health has been taken, the health, full watch is done on his health, and again the chemotherapy is given to check the status of the tumor cells. Clear? So this was your gallbladder cancer. Thank you.